Hi folks, Mark Ryan here. I wanted to take a couple of minutes and talk about an issue that comes up to me fairly frequently, and that is people are asking why when I wake up in the morning my back is sore and stiff. A lot of people think that is directly related to the position they're in when they sleep or how they sleep, and that's only part of the issue. It is indirectly related to the way you sleep and how you sleep, but the biggest part of it is flexibility. Flexibility is really the key in the soreness and the stiffness in your back in the morning. And let me explain why. The hips and the trunk area should be very flexible along with the thoracic spine part of the back, the lower part. Oftentimes that's not the case. And when we sleep at night, that's kind of a painful reminder of just how inflexible we actually are. So let me explain that. None of our joints like to be stretched to their max and then held there for an extended period of time. But when we sleep, that's exactly what we do. Let's look at it like this. If you take your hand and you bend it backwards this way, as far as you can, and hold it. Now, I don't recommend doing this, obviously, but if you hold it for like 3 hours or 4 hours, eventually you're going to start feeling pain there. And when you let go of that, you're going to feel a lot of stiffness and pain in this part of the arm. And that's really what's happening when you sleep. If your hips are inflexible, when you sleep on your back especially, your back muscles have to tighten up in order to hold you in that rest position. And it's kind of an automatic move. You're not really aware that your back muscles are doing that. But since your hips are inflexible, your back tightens up, and that's how you're going to sleep. And it's very similar to this bending of the arm back. So that's really what's happening in the morning. So when you get up, you're going to feel a little bit stiff in the back and in the hips and a little bit sore. Or maybe your hips and your trunk are just fine. They're flexible, but your lower spine, your thoracic spine is not. So I encourage people, and that's usually what I test for, is the immobility in the thoracic spine and the hip area whenever I test for the stiffness and the soreness in the back area. So I have another videos coming up on stretching and how to stretch out those hips, the thoracic spine, and keep those things as flexible and mobile as we can, because a lot of times, folks, we don't do that. So look for that video coming up, and remember, you can be better.